Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week as we continue our conversation on change, transformation, and establishing real expectations. And remembering that bio-individuality is what it's all about, meaning that every one of us may look the same, that we have arms and legs and a head and a spleen and a heart. But bio-individuality means that God created us all uniquely different. And our uniqueness is what separates us. But our uniqueness many times is misunderstood, meaning that as we take apart today's subject matter of brain chemistry and how hormones are affecting the way our bodies think, the way our bodies gain weight, the way our bodies lose weight, how we feel, how we function. Remember, guys, it's not one shoe size fits all. Our uniqueness, as created by design, will allow each one of us to establish a customized wellness lifestyle following God's plan and not man's plan. And last week we came off a show where we discussed thyroid hormone. We discussed the hormonal cascade, where we talked about how important cholesterol is in the body. And maybe many of you never thought about how cholesterol, which has been, I'm not saying high cholesterol is good for us, but cholesterol is a precursor. It's a hormone that makes many other hormones. And our hormonal structure is just like a symphony. Everything is working together in one harmonious unison, and there is one conductor, and the conductor is the brain. The brain tells our hormonal system, our endocrine system, what to do. So the glands that produce various hormones, like your thyroid, your adrenal gland, which we're going to be talking about today, ovaries, testes, liver, even your pancreas that makes insulin. These hormones are supposed to be working in one harmonious unison. Yet our medical system many times isolates one of them. So in other words, if we're type 2 diabetic, we just look at the insulin. If we're hypothyroid, we look at the thyroid hormones or the TSH. If we have low testosterone, we measure the testosterone or estrogen or progesterone. All of these hormones, then this is complicated biochemistry, but all of these hormones, as bio-individuality goes, my hormonal structure is different than yours. How I feel and how I eat and how I exercise will impact my hormonal structure. But let's say you're a female going through menopause. I'm not a female going through menopause. Your diet, your exercise, and the balance of these hormones is essential to the way you feel and the way you think. Because remember, we're taking apart Dr. Amen's book, Change Your Brain, Change Your Body. We want to take a look always at this 3-pound structure called the human brain, and the human brain runs every system in our body. So what is, as we continue the conversation, how do we balance and calm the stress in our lives? What God-given mechanism do we have that will respond to stress? Maybe you've heard of fight or flight. Okay, so you've got these triangle-shaped adrenal glands which lay on top of your kidneys. You have 2 of them. And these are very important in helping your body dealing with stress. Remember, there's good types of stress, there's bad types of stress. Your body is this miracle of life. God designed it to have a mechanism for dealing with stress. The adrenal glands produce a few different hormones: DHEA, cortisol, and of course adrenaline. Now, these are stress hormones, particularly DHEA and cortisol. These hormones act on stress. So our adrenal glands have the ability to put us into that fight or flight. You know, when you hear about this miraculous strength that a woman will have in saving their child, that comes from this power of adrenaline. The way an athlete times their adrenaline surge right before a race so they have added strength and speed. That's the power of these little glands called the adrenal glands. So if you come across a bear in the woods, your body has a built-in mechanism for fight or flight. I wouldn't recommend you fight the bear. I recommend you fly away from the bear. So this mechanism is for fight or flight. It is not a mechanism for producing daily energy. Yet in our hustle and bustle lifestyle that man has created, we're faced with an undue amount of stress on a daily basis. Rush hour traffic, family issues, work demands, lack of sleep. Minute to minute, we're connected to the outside world with smartphones and technology. And it puts the adrenal gland on overdrive. So it's constantly producing cortisol, which is a stress hormone. So after months, years of this unrelenting stress, we go through college, bad sleeping habits, bad eating habits. We get married, we have children, we have jobs. This unrelenting stress during our 20s and 30s, it puts us in this state of adrenal fatigue. And as adrenal glands fatigue, our bodies lack the capacity of dealing with this stress. Sometimes it's trouble. My patients sometimes have trouble getting out of bed in the morning, struggle to think, to function. Forget about the enjoyment of playing with their children on their front lawn or being with their spouses. I'm talking about daily functions. Adrenal fatigue also makes you fat, especially around the abdominal wall. So many patients come in and see me and they complain they can't lose weight. They're eating less and less calories and still can't lose weight. It's because their body is under attack. They're in fight or flight, and the body's not letting go of the abdominal belly and also in the glute, in the butt. The rump weight will also happen in the thighs. That's where this cortisol lays body fat down. So it makes you fat. It also increases your risk of cardiovascular disease, and it's a stress hormone that kills brain cells. Okay, very, very important, especially the part of your brain called the hippocampus, which is a major memory center. So that's why our memory starts to fail. So this adrenal fatigue is so common for all of these reasons, of course, including not getting enough sleep. And then what do? We drink many times a stressor called caffeine. So we wake up, we immediately stress our body out by drinking stress, which is a stimulant, because we don't have the God-given capacity to deal with the stress any longer. So as we go through this, gaining weight, we're tired, we have a low stress tolerance, we're craving sweets, we have a low libido, poor memory, mental fog. All of these things are going on as contributed to this stress hormone. And diagnosing this condition is not always easy. I recommend a book, Are You Tired of Being Tired, by Hanley, when I do my stress management workshops. So balancing adrenal stress, now we're throwing that into this soup, if you will. We talked about the thyroid gland. We talked about the hormonal cascade. All of this being regulated by our brain. So if we want to change our body, if we want to feel better, function better, and live longer, we have to start addressing hormone 101. These hormones are just essential. Now, testosterone is next. We think of testosterone as a sex hormone, but it does a lot more than just drive libido. So that Y chromosome that we get from dad, if we get that and we are male, we get this spike of testosterone, right in utero, which makes the brain more male. If we get the X chromosome from dad, then we don't get this spike of chromosome, and this makes a huge difference to the brain because female brains have a better capability in language. They're more interconnected, they're better communicators, and they're more relationship driven, okay? Whereas, and they're also a bit less competitive. Studies have shown male brains are wired for competition, more dominating, and not as great in the commitment aspect of life, and I'll leave that one alone. But this is a byproduct of male brain versus female brain, and our brain's wiring have so much to do with this hormone called testosterone. Now, we've heard a lot about low testosterone in men. Levels normally peak around 22 years old, and they decrease on average about 10%. Men lose about 10% of their testosterone every decade. after the age of 30. So that's about 1 to 3% each year. And this is important because testosterone affects body weight, muscle mass, sex drive, mood, energy. It's called andropause, which is the male version of menopause. So as this testosterone goes down, now remember, all of these hormones are working in concert. So we don't want to think about low testosterone without thinking about thyroid, without thinking about the adrenal gland or cortisol or cholesterol, because cholesterol actually makes testosterone. That's part of that hormonal cascade. So you're getting the complexity of this system. This is a very complex hormonal system. And by the way, this is one of those systems you should not try to fix on your own. You should really seek help from a professional trained in hormonal balancing and one who understands bio-individuality, that we're all different because your needs are going to be different than mine. Okay, so let's get back to this. Women with low testosterone, remember, once again, women have testosterone just like males have estrogen, but not enough testosterone in a woman can also really drive down libido. So lack of libido, depression, and poor memory are very common side effects with women. So we want to get this stuff balanced, and we have to start by measuring total testosterone and free testosterone on your blood test. So when you see your doctors, you're going to write down total testosterone, free testosterone, along with the things we spoke about last week, like TSH, thyroid stimulating hormone, T3, T4, insulin. These are all very important to measure on blood testing, okay? So cortisol is another one, which we just spoke about with respect to the adrenal gland. So balancing estrogen, balancing testosterone, balancing these things are going to allow us to think better, feel better, and also let's just say that feeling better allows our relationships to be better. Because again, we're dealing with the fact we're focusing on our brain chemistry. And when we look at estrogen, we have to understand that in the 30s and 40s, when women enter perimenopause, the hormonal systems just don't work as efficiently. And the changes start to take place in the patterns of the estrogen. So instead of gentle ups and downs of the estrogen during the 28-day cycle, the estrogen tends to spike and then crash. And this can really create bad PMS symptoms in a female. It's like a seesaw. So the woman's going from estrogen dominance to estrogen withdrawal. And this is not fun. It's not to be made into a joke. Okay, this is serious stuff when you throw a hormone like estrogen up and down and up and down. It's going to impact their weight, their cognitive function, and their overall health. So estrogen during menstrual cycles or later in life menstrual cycle, then perimenopause, and then eventually menopause, women will have more trouble with short-term memory, have more crying spells, more depression. Many times you'll hear women of this age, where did I leave my keys? Where did I park my car? Why did I walk into this room? And it's not funny. This is a byproduct of how brain function is being impacted by low estrogen levels and making also that female more sensitive to pain. I find in clinical practice, women of this age group have much more physical pain than any other age group. And it's not because they had trauma. They didn't have a car accident or fall down a flight of stairs. It's just day-to-day pain due to estrogen or hormonal imbalance. Now, progesterone is the other one. This is the feel-good hormone. Progesterone is like God's Xanax, except Xanax clouds your brain, whereas progesterone sharpens your thinking. And many gals out there, if you are on hormonal replacement therapy, many times they'll give you a progesterone cream. Progesterone, gals, if you remember when you were pregnant, you feel really good. You get great energy after a while. You feel a flood of enthusiasm and love. That feeling comes from progesterone. So progesterone is a really neat hormone balanced with estrogen. It also goes up and down during your cycle. And when we talk about low progesterone, we're talking about troubled sleeping, headaches, anxiety, fuzzy thinking, poor memory. Okay, those are the types of things we'll see with low progesterone. Again, once again, we want to get that balanced. Many bioidentical hormonal doctors, anti-aging doctors will use progesterone in a bioidentical cream to replace that hormone back in your body. Okay, and when we talk about HRT, hormone replacement therapy, this is really the work of specialized doctors out there because, once again, it's not one shoe size fits all. These medications that they prescribe are called bioidenticals, bioidentical hormones. I'm not going to give you my direct, whether I'm for or against them. Many times I see great gains in patients in terms of how they feel, how they function, boosting their vitality, their cognitive thinking when they're under the care of a trained anti-aging doctor who knows how to balance hormones specifically for that individual. So considering HRT, remember it is highly unique to your hormonal structure, and it needs to be done in a way that it's bio-individual. Well, that wraps up our conversation on hormones, change, transformation, and creating new expectations for our life. And if we're going to change our brain, we're going to develop a wellness lifestyle. Hopefully these last two shows gave you insight to the complexity of our hormonal system, the complexity to make change. This is not an easy thing. This requires an action plan. This requires a gatekeeper, a doctor who knows what he or she is doing to navigate you through this. And if you're going to consider taking HRT, it should only be between you and your doctor making that final decision. Thank you, and I thank you for listening to the By Design radio program. Luke 1:37, for with God nothing is impossible. Let's be well this week. Let's take action in our lives. And if you have any questions for me, please submit them at drproodian.com. Have a blessed week.